Hey, it's really nice to see you up here versus the ER because, the ER gets a little bit chaotic and it can be really hard to have a meaningful conversation down there. So thank you so much for coming up here to my office. I really appreciate it. It'll give us a much better environment to get to know each other, right? First things first though, can I just get you to verify your name and date of birth? Perfect. Okay. How are you feeling right now? Do you feel safe? Okay. You don't need to go too in-depth talking to me today because, I'm a complete stranger to you, right? And I know for myself, I don't feel comfortable just telling just anybody how I feel, It's very personal. So my goal today with you is just to establish a rapport, get to know each other a little bit. Oh, no, I'm not going to judge you. Not at all. Trauma is defined by the experience, and no one else can decide for you what's traumatic and what's not. We all have our own stress response spectrum, and we decide or we interpret where things lie on that spectrum. Nobody else can define what's traumatic for you. Okay? Okay. I am going to ask you some questions today, but I want you to think of it more like you're filling out an intake form at a new doctor's office. So it could even be like a dermatologist or, even just a general medicine practitioner. So we're not going to go super deep. I just want to get an idea of where you're at, okay? Okay. But let me know if things start to feel uncomfortable or if you start feeling like I'm really invading your privacy or you're feeling really stressed out by this. You're leading this today, okay? I'm just here to, try and get to know you a bit and see if there are any ideas that I have that could help. Okay. I do have some questions that I would like to ask you. They're just about symptoms or about your lifestyle a little bit. They're not really getting into feelings or anything like that yet. Is that okay? Okay. My first question is, do you experience any sleep disturbances such as insomnia, night terrors, or sleep paralysis? Okay. How frequently? Most nights, okay. Do you know about how much sleep, or let's rephrase that, how much sleep would you say you get on average? Okay. Okay. Have you had any increase or decrease in appetite recently? Any issues with digestion, such as reflux or irritable bowels? And how often? Okay. Have you been using any sort of narcotic or opioid drugs to try and sleep or cope with your feelings? Or in general? Alcohol use? How often? Okay. How many would you say per week? Okay. Are Is there any increase in the amount of times you need to urinate? Okay. Are you experiencing any chronic pain? And if so, where? When did this start? And my last question is, do you have any history of autoimmune disorder or heart issues? Or are you experiencing any of those currently? Okay. Well, the reason I ask these questions is because of something called allostasis, which is basically process of achieving stability when it comes to stress. Our bodies tend to distribute the stress reaction across bodily systems. So think about it like you have a cold, right? Your cardiovascular system is going to get involved to, circulate more blood cells to help and try and attack whatever pathogen is in your body. Your metabolic system is going to be affected. It's going to be increasing your metabolic rate to try and help fight, your atomic, your central nervous system. All of these systems are working together to try and fight this pathogen that's making you sick. And the same thing can happen with stress and trauma, is that when it hits our body, multiple systems across the body can be affected. Okay. But just like our bodies are designed to go into fight or flight or freeze when we experience stress, they're also designed, they're hardwired to be able to heal from it. Sometimes, though, we need a little help. So that's what I'm here for. Which leads me into my next thing, which is acupuncture. This is something that I've found has really, really helped a lot of patients start to overcome trauma. It helps by basically allowing certain systems that may be activated because we are so stressed to relax, or activating systems that we might need to help us heal. So that is something that I think would really benefit you if you're open to it. Yeah? Okay, good. But before we get into that, there's something else. I'm going to move this. There's something else I'd also like to talk to you about, which is something called brainstem work. Okay? Brainstem is the area for hypervigilance. So, when you have anxiety, particularly if it's really active, how you're just aware of everything. And we tend to hyper-focus on things, right? We just can't really let it go even if we want to. So, something called brainstem work can really help. It is just using my hands on the base of your skull and the top of your neck. Even though it's on the external part of our bodies, we gotta start with what we can control. So, what I would have you do is just lie back, okay? And I'm gonna move really, really slowly. So, I won't even touch you at first. I'll just sort of get closer and closer and closer to you until I am touching you. Just so you can get used to me being near you. And then used to my hands, okay? Does that sound like something you're open to? Okay. Well, then I'm going to have you lie back, alright? and then we will begin. Okay. So, are you comfortable here? Okay, good. Would you prefer that I put on gloves before touching you? I will need to put them on anyway to do any kind of acupuncture. Yeah, not a problem. Just grab. Some gloves here. Okay. So for starters, how are you feeling with me just standing over you? Is that okay? Okay. My hands are not here. I'm not touching you yet, okay? And my hands are up here, not here. So I'm just going to move them just a little bit closer. How does that feel? Okay. How about if I move them just a little bit closer so they're almost to the sides of your face? Okay. And now they're on either side of your head on the pillow. How's that? Okay. Let's just take a deep breath here, okay? So now, they're on either side of your neck. Take a deep breath. Good. Now they are lightly grazing the sides. You're okay? Okay. You ready for me to place them on the back of your head? Okay. I'm just going to be applying pressure right here. Try and take some deep breaths with me, so. Good. You're doing great. So let's try and focus on relaxing just a bit. Keep breathing. Okay, good. I'm going to slowly remove my hands now, okay? Okay. Good. That was a great first start. So, I'm going to start with our acupuncture, okay? First, I'm going to be cleaning your face and your ears. So I will be putting, they're very, very thin. You shouldn't even feel them go in, but little acupuncture needles just into some parts of your face that will be helping different systems in your body calm down just a little bit. Okay. Yeah, it should be really relaxing. And I'm also going to be putting some acupressure beads just on your ears. They're not needles, they just basically do the same work, and you can actually wear those for the rest of the day if you like. Okay? Okay. So let me grab a swab really quickly just so I can clean you off a bit. Place that by your head. So I'm just going to be using this tiny little square just to clean off your forehead and some parts of your cheeks, and then your ears, okay? Really lightly. Just dry that off. Okay. Just gonna lay this just right beside your head here, okay? So like I said, these are very, very thin. The first one's going to go right in between your eyes. This one connects to your heart, okay? You ready? Okay. Deep breath in and out. So that's going to stay right there, okay? So the next one is going to be your large intestine, okay? And this one goes over on the forehead. Right here. Okay. And then the small intestine, which is the other side of the forehead here. Okay. You're still doing okay? Okay, good. So, now this one is for the stomach. Okay, it goes a little further down the nose. right there. Okay. Gonna do another one for the stomach. So right here. Just like so. And then the kidneys. Right there. One more. Going right there. Okay. How do you feel right now? Your vision's a little blurry. That's okay, that's normal. So, let's take some breaths and let's try to relax, okay? You're doing great. I have this little sheet here, and it has different acupuncture seeds we're going to be placing in your ears. They're just like little stickers, but they do put some pressure on different points in the ears that connect to different bodily systems. So, I have my little tweezers. They're going to use these to pop these off. So, alright, so placing the first one now. Good. tweezers out of here. Alright. How are you feeling right now? You okay? Okay. I just want you to take some time and just relax here, okay? Just for a few minutes, and then we'll sit back up. Yeah, I'll take the needles out. Just 1 moment. Just gonna make a few notes in your chart. And now I'm just going to remove these needles from your face very lightly, okay? So. Vision should start becoming less blurry now. When you're ready, go ahead and sit up for me, okay? Okay. How are you feeling? You feeling relaxed? Good. Good. Better or worse than when you first came in here? Better. Good. Excellent. So, looking through my paperwork, see that you have taken antidepressants in the past, but you had a bad reaction. Yeah, I see that. Okay. Not every medication is for everyone. The brain is sort of mysterious still. So sometimes it takes some experimenting to get things right. We don't have to start there. We can start just by doing some talk therapy as well as some acupuncture and acupressure and brainstem work together, okay? And then as you feel ready, we can talk about introducing you to a psychiatrist who can prescribe. And I still want to see you, even if you are on medication. Therapy and medication work together. So, is that something you're open to, potentially, though, in the future? Okay. You don't need to decide right now. We can take our time with this. Like I said, it's good to go slow. Okay. So, I would like to see you back in a week, if possible. We can start having weekly sessions. Is that okay? Okay. Let's see. So, I do have Thursdays open at 10 a.m. and also 1:30 p.m. Do either of those times work for you? Okay. You'll get a reminder call about 48 hours beforehand about the appointment. And then that way, if you need to reschedule, you have time and I have some notice. Okay. So, I'm really glad that we were able to see each other today. And I'll see you again next week. Maybe at that point we can talk a little more. But I'm going to let you, for now, set the pace and see if we can't build up some trust and rapport so that we can start getting into some deeper work. But I don't want you to feel pressured, okay? You decide when you feel comfortable to move forward, and I'm going to follow your lead. Okay. Well, it's really good to see you. You take care, okay? And if you need anything before your next appointment, just give me a call. Okay. You take